Hi, my name is David and I'm the President of the UQ Medical Society. I'm here today with Professor Stuart Carney, the new Medical Dean of the Faculty of Medicine. Thank you, Professor Carney, for taking the time to answer a few questions this afternoon.
Thank you, David. It's a pleasure to be here.
Thanks very much. Can I just start with a broad question? Can you tell us a bit about yourself?
So I am from the UK. I'm a psychiatrist by background. I most recently was Medical Dean at King's College London, and I have been interested in medical education probably for over a decade, largely born out of my interest in public health when I began to realise that education provided an excellent opportunity to improve patient and population health.
Brilliant. Well, that's an interesting fact that our new medical dean is a psychiatrist. I was wondering if you could just tell us a bit about your most memorable experience in medicine.
Good question. I suppose there's sort of two memorable experiences. The first one obviously would be some of the educators that influenced my development as a medical student. One particular wonderful chap, Sir David Carter, who had some wonderful expressions when an operation wasn't going too well, you were in tiger country, and that particularly in general surgery, that meant that you had to bring up a loop of bowel, sort of kick for touch. But I think one of my most memorable experiences as a clinician was probably an early realization that we as a team had been very good at managing a patient's psychosis. We'd done a great job at controlling their symptoms, but their HbA1c, sort of an indicator of diabetes control, was totally deranged. They'd put on a lot of weight and the teeth were in a particular bad way. So I think it reminded me of what a colleague in the UK would say, sort of meeting the target but missing the point, and that was one of those sort of revelations that sort of we as doctors needed to up our game in ensuring that we cared for the whole patient and not just getting the area that we specialised in right.
Well, I think that what you said there about meeting the target but missing the point also translates well across to what you're going to do here. You're our new medical dean. What is the point of a medical school?
What is the point of a medical school? Well, I think the fundamental point of a medical school is ensuring that our graduates are well prepared to serve the needs of patients and the public.
Okay. And so, like, coming to Queensland, coming to UQ, coming over from the United Kingdom, what were you most excited about?
The weather, of course, although it's been a little bit more humid than I was led to believe. I think really excited to learn about a new system, to work with colleagues, to approach the challenges that we're all facing within healthcare and medical education in different ways, so sort of a fresh outlook.
Okay. What about, what were you most apprehensive of?
Well, I think I've become increasingly aware that we might be divided by a common language, we may all speak English, but here it's important to understand that when somebody says no, it's important to attend to the second word, that it is the no. And I'm now working my way through words which end in O.
Such as?
Well, rego,
defo,
fair enough, devo, avo, arvo.
As in avocado?
Apparently.
That's right, okay. Yeah,
well, sometimes it means the afternoon.
Oh yeah, the arvo. You'll get there one day, I think. I suppose you've been here for a number of months now, and talking about that sort of division by a common language, what is your first impression of us, your UQ medical students?
UQ medical students, great men and women who are sort of committed to making a difference and potential to be the future leaders the healthcare systems both in Australia and across the world need. Great men and women.
Well, over the past couple of months, you've actually been to a number of the events where we've had a lot of the medical students here, and you came to the Ashintosh's Coffee House afternoon a couple of weeks ago, and apparently something happened there. If you want to tell everyone.
Well, it would appear that my sort of visibility as medical dean's not quite as high as I initially thought, that there were some of your colleagues, David, who thought that I was a third-year medical student, misunderstanding the question sort of when I arrived. I said I arrived at the same time as you, David, if I remember correctly, and that meant that particular group thought that I was the third year. Others mistook sort of medical dean and thought that my first name was in fact Dean, and some of the handshakes were a little lackluster.
Yeah,
but I understand you clarified later with your fellow students that I was in fact sort of somebody important within the medical school, and that next time they're going to put more effort into my handshake.
Well, that's right. I remember we actually got you up on stage, and you refused the musical number, but maybe next time we can see you up in there, maybe do a few jokes or something like that.
I think I'll need a certain amount of practice for that. When I got advanced warning of some of the questions today, I did ask the Faculty of Medicine executive if they had any jokes, and we're going to need a few months' notice.
Well, we'll work on that with you over time.
Thank you.
I remember your first day with us was the orientation afternoon. So you got up on stage and you spoke to all the first years of the orientation. I suppose now you've got a great opportunity to speak to all of the UQ medical students from years 1 to year 4. So with that, what would you like to say to them?
So I think the same messages from that orientation afternoon still stand, and that is we are facing sort of enormous challenges within medicine, within healthcare. That 23% of the Australian population are living with 2 or more long-term conditions. That people with severe and enduring mental illness die 16 years earlier than the general population. We have a real opportunity to draw upon the immense talent and leadership capabilities of medical students to really solve some of these complex challenges, reduce some of the fragmentation within our healthcare system. But I think what I would add to that, when you start in a new job, you're always very sort of keen to make lots of changes, and I think that's a sort of a good analogy for becoming a great doctor, that it is fundamentally a marathon and not a sprint, that we need to pace ourselves.
Okay, that sounds really good. I was just going to say something about that. You're a psychiatrist. You're a medical educationist, you're our new medical dean. One of the things that speaks really strongly to a lot of medical students at the moment is their well-being. So what would you say to that?
And I think fundamentally we are in a caring profession, and being in a caring profession means we need to care for ourselves. It's not an either-or. We can only provide for the patients that we look after if we look after ourselves. So I would essentially say, enjoy medical school, enjoy the friends, enjoy the networks that you create, make sure that you get a work-life balance, make sure that you take advantage of the wonderful opportunities that UQMS provides, the university as a whole provides, and set the sort of the ground rules for that sort of fulfilling career, which is around balance and deriving sort of great joy from being around other people.
Okay. Now we're getting to the end of the interview here, and I think what we really want to get from this is not many medical students understand what the medical dean does. And so I just pose to you, could you describe what did you do today for medical students?
What did I do today for medical students? That's a great question. So I suppose today it was around prioritising what are some of the issues that we need to work through over the next year. So firstly, it was around setting up a couple of major reviews, looking at the academic and professional support systems and structures that we provide for medical students, looking at the selection processes as well. And I suppose the highlight of the day was opening the new student hub with the Deputy Vice Chancellor Academic. Wonderful facility on this campus.
And the last question, and I think it might be the most important one, who's going to win the Ashes at the end of the year?
That's a very difficult question to answer. Obviously the best team.
Yeah.
India. No, I think it would be drawn on this. It's a difficult one to answer. So worried that you might ask me a question like this. Did you realise, I discovered on Wikipedia yesterday that the Ashes series have been run 69 times. In those 69 times it was 32 wins for England, 32 wins for Australia, and 5 draws.
Well, I didn't know that. I've clearly got to do a bit more research. Thank you very much, Stuart. UQ medical students, you're medical dean. Thank you very much.
Thank you.